In the Women's Center, because it's been shown that women have a healthier birth with support system, we do allow 2 visitors. They come in with the patient. They cannot leave. If they leave, they cannot come back into the department. So it's a one shot. You can come in and be with them while they're there and support the mom and help the mom with the baby during her stay. If a mom has COVID during her pregnancy, she will receive antenatal testing, and that's testing before you deliver. And she has to come in and be hooked up to a monitor twice a week and have an ultrasound once a week. Is the way that that's being monitored at this point to make sure that both she and her baby are safe. As they talked about with the decreased oxygenation in COVID, that has an effect on both the mom and the baby because the baby relies on the mother for her oxygenation. So we check and make sure that the baby's growing. Now that's going okay. That does not happen on our labor and delivery department. We try to keep that in another area of the hospital and come to them. But if you are in labor, you need to be seen in labor and delivery. You would enter isolation. You are down to 1 visitor, and that person must stay. And if your baby's delivered, we are trying, the trend now seems to be trying to keep mothers and babies together instead of taking the baby to an isolation room in the nursery. So we have isolate. A lot of people know it as an incubator that we can keep the baby in so that the baby can stay in the room with the mom. There is not a lot of vertical transmission between mother and baby that we are seeing, and that means that through the blood. But we don't want her to transfer with her droplets. So what we ask mom and her support person to do is when the baby's in the room with them and not in the isolate, which provides a physical barrier, to wear their mask while they hold the baby so that the baby has a less chance of becoming infected. We've not seen a large percentage of the babies becoming infected, and we don't know a lot about that, but our ACO, which is the American College of Obstetricians and Gynecologists, is highly and strongly recommended that all pregnant women receive the vaccine and that all people who work with pregnant women and babies receive the vaccine.